So good evening, everyone, and again, thank you for joining us in our Kawakeb Webinar series. Today, we have a very special guest, Dr. Ghaiath Hussein, whom I had the chance of meeting quite some time ago, I guess. And I have to put in, even if only one personal word, if you wish. Dr. Ghaiath is a very dear friend, a very enthusiastic scholar, and a very active physician/ethicist. I'm very happy to have him with us today, and we continue, and hopefully, inshallah, we will continue to work together, Ghayath. And I cannot say more. You know how much you are dear to us. You are a very dear brother and colleague at SHPPP. So thank you for being here. تعالى اتفضل إذا بدك تحكي شيء ما قصدي to interrupt.
No, okay, it's okay. Tell please.
Hello, everyone. Welcome to our Kawakeb Webinar. So I will introduce Dr. Ghaiath. Dr. Ghaiath is a medical doctor, bioethicist, and assistant professor in medical ethics and law at Trinity College, Dublin. He earned a master's degree and PhD in bioethics from the University of Toronto, Canada, and the University of Birmingham, UK, respectively. He is the main co-author of the Professionalism and Ethics Handbook for Residents, the main training and the medical licensing examination reference for medical ethics in Saudi Arabia and other GCC countries. He has also contributed to other training manuals, including the WHO's training manual on ethics in epidemics, emergencies and disasters, research surveillance, and patient care. For more than a decade, he has been teaching bioethics for medical students, interns, researchers, postgraduate trainees, and public health practitioners. He has been helping medical schools and health institutions in Saudi Arabia establish bioethics departments, develop medical ethics curricula, and set examination standards. Regionally, he has helped in developing and delivering the first public health ethics curriculum in the Middle East in collaboration with EMPHNET. His international expertise includes providing consultations and membership of research ethics boards, along with writing modules and training manuals for organizations like WHO, UNESCO, and MSF. Go ahead, Dr. Ghaiath.
Okay, good evening, everybody, and thank you, Talia, for the nice words and the nice presentation. You're a great sister and friend and colleague, and when these words come from the pioneer of bioethics in the region, they mean a lot to me. So thanks again, and it's my pleasure to be invited to Kawakeb Bioethics series. I'm going today to talk about the ethical considerations in research during armed conflicts. And I believe, first of all, it's a topic dear to my heart, and you will know why in a minute. And I believe it's timely also, given that the ongoing, unfortunately, the ongoing armed conflicts in the world now. So I would start by a disclaimer that these views, the views expressed in this presentation are mine and do not represent any of my current or previous affiliations. I have also to acknowledge that what I'm presenting today is the product of part of the product of my doctoral thesis, which was fully funded by Wellcome Trust in the UK, supervised by Professor Angus Dawson and Professor Heather Draper. Dr. Khaif Musharraf, a great friend of mine, has also helped me in the systematic review that I'm going to present. I'd like also to thank and acknowledge the role of Center for Research on Epidemiology and Disasters based in Brussels for their help as well for the systematic review that I'm going to present to you today. So what I'm going to discuss with you today is about what is the impact of armed conflicts on research ecosystems. And I want to emphasize this from the very beginning, that when we're talking about research, we need to be talking about the research ecosystem. It's not the traditional research participant kind of setup, and we will come to that in our talk today. I'll give some examples of the ethical considerations in research when it comes to armed conflict, just to exemplify how the armed conflicts could affect the different stakeholders in the research process during an armed conflict. I'm going to take you with me again with the empirical journey that basically my doctoral thesis, my doctoral project journey, which I keep on bragging about every now and then, and basically about the conceptual journey that took me from one position to another, and the methodological route as well. And I believe that this is hopefully could inspire, or at least let us think about the importance of our conceptual standpoints as well, and what kind of methodologies that we can use when we are studying ethics. Then I'm going to share with you a couple of findings. One of them about a systematic review that I have conducted with my colleague Khalifa Musharraf, and the part of the qualitative empirical project that they have conducted with the internally displaced persons, the IDPs in Darfur in Sudan. I have a quick thought, perhaps a quick word about the situation in Ukraine, and few take-home messages that I hope that you'll find them helpful. And I will try to finish, perhaps as early as possible, to give time for discussion as well. So this is the movie that we all aware of, or we have been seeing again and again, especially in the Middle East. Unfortunately, we have vulnerable communities in countries which are usually low-middle income countries, non-democratic, under corrupt regimes, and then at one point of time, the armed conflicts happen. What happens is there's an influx of humanitarian aid, humanitarian agencies, along with journalists, human rights activists, actors and actresses, and they all come. Okay, and then there's usually a very active process of collecting data, sometimes even biological samples, for the data is being collected because they need it for the planning of humanitarian aid, assessment of its effectiveness, and many other purposes. The aid planned, given for some time, it could be at many for many years. We're talking about the situation in Darfur. It started 2003. We're talking about almost 20 years now. The situation in Syria is not much better now. It's over a decade. The situation in Yemen and many other countries. One point of time, the NGOs leave, and arguably, and perhaps you can disagree with me on that they leave the communities where they have started, and perhaps sometimes even worse. To take it a little bit personal, this is a plot twist, if you wish, in the usual movie. What happened is I was responsible for the Sudan Household Health Survey, which is a national survey. I was the manager of that survey in one of the biggest Darfur state at the time, the South Darfur state. One of my teams went to a village which was classified as safe. At the time, that what happened is that they went there, the village was attacked, and the communications were cut. To cut a very long and dramatic story short, what happened is they managed to get out of the village safe with the questionnaires, and they have started collecting questionnaires, and the questions were very detailed. We're talking about the names, we're talking about locations, we're talking about a number of children, we're talking about the income, any kind of identifiable information that you can think of were there in these questionnaires. And this led me to think, what if they the you know my sons and daughters, because they were as young as 18 and 19, some of them, and some were girls. What if they were raped, for example? And this was unfortunately a common practice in the conflict in Darfur, among other armed conflicts as well. What if they were killed, basically? What if these questionnaires with all these detailed information fell into the wrong hands? It would be just simply a kill list with all these details. So this stopped me and start to think whether this is the right way of doing things. And this question kept on nagging from 2006 until I managed to take it to my doctoral thesis, as we will see. So how the armed conflicts affect research? Let's make a comparison between the normal, if you wish, the normal peaceful setting, where the cycle as we know it, as we teach it, as we study it. We develop a research. Who's responsible for that? The stakeholders are known, the researchers, the PIs and the institutes. Then We look for fund, ethical approval, who are the stakeholders, the funding agencies, the research ethics committees or boards or the IRBs. Then the research is conducted, the stakeholders are known, we have the researchers, we have the participants, we have the research setting. Then the report is published as disseminated in a conference or in a publication and so on. The stakeholders are known, we have the researchers, funders, and institutes. When we come to the armed conflict, it's not as nice and neat as it is here. First of all, we have many stakeholders and they are not neatly separated from one another. We're talking about the affected communities, IDPs, the refugees, the host communities. We have the local bodies, could be, the university in that region, or academic institute or research institute, if any. Then we have the governmental bodies, the Minister of Health, the Minister of Education, the Minister of Agriculture, and other the agencies. We're talking about the armed forces that are present as part of that armed conflict. We're talking about the governmental army, or talking about militias. And then we're talking about the funding agencies. So the humanitarian work is more or less the intersection of all those factors and circles. And even the humanitarian work is not delivered consistently by a single kind of a provider. We're talking about the UN agencies. Each of these agencies has its own mandate, its own area. We're talking about the international and the national organizations. We're talking about even the independent players. And the humanitarian work itself is a mix of humanitarian aid, like for example, food items and non-food items, and it includes data collection and biological samples collection. So we're talking about research, and in addition to the provision of clinic, which also includes collection of data. So where we are when it comes to that. So let's have some examples of the ethical considerations in research and armed conflict. How do they affect the different stakeholders? So in terms of the international researchers, the humanitarian agencies, the affected communities, the research ethics committees or boards, and the local researchers as well. The list is quite long, and I do not assume that the list that I'm going to present to you is kind of exhaustive list, but just to give us a sense of how the armed conflict could affect each of those stakeholders. When we're talking about the international researchers, as I said, just what I've seen in the previous diagram, where the line between, am I presenting a service, I'm giving a service, or am I conducting a study? Where to draw the line between, because I'm collecting data, I'm collecting biological samples. So, and this is one thing, and again, the phenomenon of parachuting, sometimes med students coming from the global north to that area to kind of train, to have some sort of training, or perhaps just to boost their CVs and so on. The issues of ethical approval as an international researcher, if I want to have my work ethically approved, where should I go? Where can I go? Very few international organizations have their dedicated research ethics committees, and within these countries where the armed conflicts are usually taking place, usually, again, this is kind of like I would say general statement rather than numbers. It's about the ethics situation in these countries is questionable, to say the least. The issue of humanitarian immunity in terms of what if something goes wrong. If something goes wrong in the research in the global north, in the European Union, in the States, in Canada, the perhaps more where the state of flow, down the flow in if something goes wrong in research, then someone is held accountable. What if this happens in again, back to my example, what if my team was kidnapped, was the girls were, may God forbid, or even killed? Who would take the responsibility? There was no insurance, and again, who is responsible for their safety? The issue of safety and access, again, back to my example, that when they went, it was okay, and then all of a sudden things can change like that. And again, the issue of accessibility, and it has also its own implications as well. The humanitarian agencies, they tend to give the impression, as sometimes there's a genuine pressure in terms of they need to act, they have to act fast. The issue of priorities, the priorities of whom? Of the agency, or the funding agency, or the communities, and to what extent the communities are involved in the planning process for the humanitarian aid, if any. The issue of conflicting of interest. Again, even if we assume that we say, like in the guidelines, if you should seek the ethical approval of the national ethics committee or the local ethics committee. But the reality is these humanitarian agencies are basically funding the healthcare system within these communities. They are paying sometimes even the university professors who are supposed to be members of these research ethics committees. So this is an obvious conflict of interest. Again, why are the data being collected? Is it to plan for aid or to raise the fund? And in a way, what is ethically significant about that? Sometimes, at least theoretically, uh, the the worse the number, in a way, the worse the number, the worse the humanitarian situation, the better chances that this agency is getting more fund. And I'm not accusing, I'm just saying that this is a theoretical consideration that need to be taken into consideration. So we need to make sure how the data is collected and what are the purposes of collection of these data. Also, there's a concept which I found as a part of my empirical work, is the so-called institutional vulnerability, and we'll talk about that later. When it comes to the affected communities, the issue of vulnerability, and because they were vulnerable even before the conflict have started, but after given this vulnerability, what they do is they try to restructure themselves so that more roles are given to the community leaders, because they are the ones who will protect them and kind of negotiate for their best interests. The issue of accessibility would lead that some areas which are safe and accessible are being over-researched, while the areas which are not accessible due to safety reasons, they'll be under-researched. So the planning is based on numbers that are coming from certain areas and not other areas. And we have seen this, for example, in Syria. It depends on who is controlling which part of Syria where the humanitarian agencies can work and plan. There's also the issue of unrealistic expectation. It's extremely difficult, no matter what you say in the consent, to convince the people that someone living in a camp at the bare minimum life, that you are knocking on his door or her door and telling them that I'm not here to give you anything, I'm just collecting the data, there is no direct benefit to you, etc., etc. But at the very least, at the very bottom of their hearts and minds, I believe that they are expecting something from you. And this happened to me personally in my doctor project, and perhaps if we have time we can discuss that and give you a couple of examples and how did I manage that. When it comes to the research ethics committee within the country or outside the country, and most of the time it is the international um, uh, ethics committee, in terms of, so what kind of framework, what is the guideline here? And we have seen the dilemma now that's happening in Ukraine, and we'll talk about that at the very end of my presentation, about what kind of framework and whether these frameworks are matching, and the ethical principles there are the same within these affected communities or different. There's also lack of clarity about the local setting. We ask the researchers go to the local community, so to the local ethics committee, and have their approval. We don't know whether there is one or not, if it's functioning or not. Then at the level of the local researchers, many times I would say that they were kind of marginalized in a way. So their role, even if they are, for example, doctors or qualified researchers, they become more or less data collectors rather than actively involved in the research process, and to what extent this is ethical. The issue of conflict of interest as well, being paid by the agencies they are that they should be like kind of monitoring, if you wish. The issue of their own personal safety, and we are aware of many incidents where the local researchers or the local vaccinators or the local members or local staff of the NGOs are more prone to being abducted, to being killed. The issue of confidentiality, given that the local data collectors could be part of this tribe or that family, and to what extent the data can be easily and freely shared, and the confidentiality is respected. So how did I manage, or how did I try to manage to examine these ethical issues? Um, I'm going to share with you fairly briefly the conceptual journey. Where did I start and where did I end? What is the methodology that I have used? And again, this is not just, it's not about bragging about my doctoral thesis, but basically it's for discussion and an example that is not a perfect example, but it is an example of how can we study ethical issues in armed conflicts. And I would love to hear from you if you have any perhaps suggestions so that the future researchers can improve it and take it even further. So the conceptual journey, I started as a believer in autonomy, in the individualistic Western version of autonomy. And this is not because I've studied in Canada necessarily, but because I believe that bioethics is a democratic empowering tool. No wonder my very first publication more than 10 years now was about exactly that. The forgotten challenge for bioethics in the developing countries is democracy. And the issue is, so the standing point or the conceptual point was that I believe in autonomy, I believe in informed consent. The NGOs are not taking the proper consent from the people, then they are wrongdoers. Go and take them to show them the ethics teeth and the policing of ethics. And to be honest, they feel like just a sitting duck because the numbers and the documents, and we'll give you examples of that from the systematic review that I have conducted. But given the tone of my writing and the very beginning of my project, and in here I have to give the credit to my supervisors, and especially Prof. Heather Draper, who asked me like, Ghaiath, if you are so being so judgmental or so enthusiastic and sympathetic with the issue of autonomy and the importance of autonomy, what is the point of going there? What do you want to go to that for? What do you want to talk to the people affected by the armed conflict there? Stay here, make it a desk review, read the literature, and that's it. To me, it was frightening because basically she's not happy about my progress. But I believe that the more important message is that if I need to talk to the people, I need to kind of neutralize myself. This was a moment where I had the chance to see my bias in a way. Then the people talked, and we'll show you the example of what is the difference between the numbers as we'll see here in the systematic review, and what the people said later on. So how I managed to do it, or how I try to do it, is the review of literature, the research, ethics, humanitarian ethics, disaster ethics, public health ethics, and law. Then a systematic review that I'm going to share with you a couple of findings about it. And then I went to the people affected by the conflict, mainly through in-depth interviews and focus groups with different stakeholders, and I'm trying to summarize it because this is not the main message that I'm trying to share with you today, but it's just an example of how to study these issues, and then ended up by a philosophical analysis and a framework development. So what the document said, I have conducted a systematic review where I have tried to go through the studies that were conducted in Darfur that collected data, identifiable data, and or biological samples in the study period done by most of them were done by the humanitarian agencies anyway. So different different routes, and this, as I said, it's not the purpose of my talk today is to go in depth in that, but the findings is what I want to emphasize here. So if you can see here, the graph is the mention of informed consent. I was looking for two main variables: whether the study that I am including in the systematic review mentioned that informed consent was taken and ethical approval was taken, and if it was taken, what was the source of it. Informed consent was slightly better. For example, in total, we're talking about roughly 60% of the studies mentioned something about having informed, the online search. And then I went to CRED, which is basically the Center for Research of Epidemiology and Disaster in Brussels. They have like shelves, physical shelves where I have the studies and the report of the studies there. So what happened is I looked basically for those two variables, the informed consent and the ethical approval. The informed consent was slightly better. About 12% mentioned that they have taken the informed consent. 42, more than 42% in the online search. When it's come to the ethical approval, the online search, which is basically the reports that were publicly available online, Only 12% of the studies mentioned that they have ethical approval. For that in CRED, which is the Center for there in Brussels, of all the CRED, I'm talking about 138 reports. Okay, none of them mentioned that they have ethical approval. And if I follow the numbers alone, I would say like, okay, that's it. I have the proof. The humanitarian agencies, you are the wrongdoers. You're not doing your job properly. So I put like 5 possibilities for that. Either the exempted from ethical review, mentioning ethical review was not required, was not considered by the researchers as if granted, and so on. You can go to the publication later. But what really matters here is when I went to and talked to the people on the ground. I talked to the researchers. I talked to the research communities, the affected communities, the IDPs. I talked to the oversight bodies, whether the research governance bodies represented by the National Research Ethics Committee in Khartoum, and sorry, the humanitarian governance represented by HAC, the Humanitarian Aid Commission. So they gave me a different version, basically, of what I thought. So, for example, if we talk to the numbers alone, that they're not taking the consent, they're not taking ethical approval. There's something wrong is happening here. However, when you talk to the people, you get a different story. They told me that, for example, they didn't believe it's research in the first place. Some of them said like it's previously reviewed tools, so the questionnaire that we are using is already validated. It has been used somewhere else. The justification was that the studies were low risk studies, were not taking blood or not experimenting or doing any clinical kind of studies. Ethics was fought without a formal review, and this was quite a nice argument. Like, why the heck do we need to submit proposals if we know what we're doing and we are doing it right, and nobody's hurt or harmed with that? And then, like, there was again one justification that we didn't know about ethical review, that we didn't know that there is an ethics committee in the country. In addition to the common arguments where there was an emergency situation, there is a time lag if we submit it for the research ethics committee and so on. And they have provided, and this is perhaps I won't say the more important part, but perhaps the more enlightening part that I want to highlight. They have provided different models, different concepts. For example, as I said, I started from a very individualistic kind of autonomy, but what I found there is they have the consent, but their version of consent, it's an iterative consent. That applies the relational autonomy and the community representation. And they have very well structured kind of review that they do by themselves, and I will give you a summary of that in a minute. They have raised the issues related to the power, to the vulnerability, and how vulnerability and the social restructuring and the role of the community leaders have changed due to that, and how the main issue for them was not the autonomy per se. It was about trust and trust and mistrust, and we will see what is the importance of trust when it comes to research. They have raised issues like reciprocity, risk, and benefit, and they have even suggested alternative ethics governance model. I'm not going to present all of them, obviously, but I'm giving just a couple of examples. One of them is about the oversight. Instead of the traditional model where the proposal is submitted to research ethics committee, the research ethics committee see it, review it, ask the researchers to make that change, and then it's okay, you get the approval, go to the field and do it. It's a different way of doing it, and I found it perhaps more comprehensive than the research ethics committee model. For example, as a researcher, and this happened to me personally when I went to the field. Well, when I showed them the ethical approval that I have from Professor Birmingham and the National Research Ethics Committee, and things like it, forget about the paper. We're not here talking about the paper. We're talking about you. Who are you? Tell us about yourself. What are you doing? Why are you doing what you're doing? And so on. So the initial approach with the community leaders, okay, and they were described, by the way, by the participants. The community leaders were described were described as the gates of the communities. So if you want to go to any community, you should go through the gates, right? So the gate is you have to go through this kind of trust checkpoint where the community leaders negotiate and test your trustworthiness as a researcher or as an aid, as a humanitarian agency. And by the way, this is very important, and this is one of the interesting things about this model is they apply the same model for whether you are coming to propose a research study to be done in their community, or you're suggesting a new project, humanitarian aid of any kind whatsoever. And then when the community leaders, when you kind of like they tick the box in terms of your trustworthiness, then the community leaders, they do not impose. That's what was the impression before doing my project, that they kind of impose on the community. Now I'm giving the green light, open your doors, let the researchers collect the data. It doesn't work like that. There's and a very important and I found it what I described in my thesis as a quasi-parliamentary meeting where the representative of the community meet together with the community leaders. They discuss it, and interestingly enough, I found that very good representation for women. Oh, well, there were some issues related, by the way, I should have raised that when it comes to the armed conflict issue. It's like there it is more likely to find more women than men in this context, and given the cultural sensitivity as a researcher, it could be challenging for you to talk to women directly, and this is one of the challenges that I have faced. And if we have time, perhaps I can tell you how did I manage to overcome that. Then the leaders talk to the people, and then the issues are raised, and then after all these checks and negotiations, if you wish, then the households are open, and at this point you are allowed to go to the household and talk to the people, not because you have a paper from international agency or international committee, but because you have the trust of the people. So what they are doing here is what I call the trust-oriented, community-based, multi-tier, multi-layer, quasi-parliamentary oversight model for all the activities, all the internal activities, and not only for research. Also, the concept of community consent, they have provided a very detailed kind of approach towards what consent is and what the community consent. For example, they want to the relevant authorities and community leaders should be involved first. So the concept of consent for us as individual communication process between the researcher and the participant does not fit within their model of consent. It's a kind of collective decision. You should go through the gates first, talk to the authorities first, talk to the people, to the community leaders first. Sorry. Then there's a wide participation of the community members. So it's a decision that need to be, as I said, it's a kind of quite a micro democracy. And I can tell you this is better than many elections in many of our countries. I don't want to mention names, right? So again, the participants were informed and their consent was sought individually after the community consent. So the community consent does not replace the individual consent. It's just like the kind of the general agreement that for this study to go ahead. And then both the individual and community consent were complementary, not exclusive to each other. And again, they were very okay with two things that we feel a little bit uncomfortable with when talking about from the Western kind of ethical review, to have the consent verbally and to have the consent not very informed in terms of it's not a matter of how much information you give. It's about if you're trustworthy or not. I know this is tricky. I'm not saying that this is perfect, but what I'm saying is the armed conflicts can affect the mindset of the people. And I believe as people who are talking about research ethics and interested in ethics, we need to address these issues and do not assume things about how should research be done in armed conflicts. Talk to the people and listen to them and make them part of your planning and your ethical guidance as well. Then they have even agreed on selective disclosure. That's to say they don't want to know each and everything about it, but it's some of the main issues. This is a kind of a traditional classical armed conflict. Then came Ukraine, which, to be honest, I'm still studying it. And again, I have to another disclosure is I am part of the kind of international initiative. It's called Ukraine Clinical Research Support Initiative, which is kind of evolving, and Talia also is part of this initiative. So it's a different story, because we're not talking about a low-income country. We're not talking about a country where there's no research setting. We're talking about a country when the war started, there was more than 300 clinical trials ongoing in that country. So we're talking about complete, and this is not a new thing. It's been there for more than 10 years. Hundreds of clinical trials, let alone the other kind of research. Just think for a while about what is the impact of this, of the current invasion, the Russian invasion to Ukraine on the many ethical issues. For example, what will happen? Should they go somewhere else? And what about the person moving? Well, now they are refugees in Poland, Romania, any other countries. Some are even in the States and Canada. So what kind of ethical issues about the cessation of these clinical trials or the continuation? What are the standards, and do they kind of need to reapply for ethical approval again in the new countries, and what kind of laws? Although the European laws are more or less the same, but obviously there are differences from one country to another, and many other ethical issues. If we have time, we can discuss. So my take-home messages. First of all, the armed conflict affect all the components of research ecosystem, and I repeat this because it's very important not to think about research like researchers sitting with a participant, collecting data and leading. It doesn't work like that. They are not sitting in vacuum. There's an ecosystem that we need to think about comprehensively. We don't need to agree on a label or activity to be ethically overseen. In other words, I don't have to call this activity research to have some sort of ethical oversight about it. Okay, I'm not saying that each and every activity that have data collection should go to a research ethics committee, because I believe that ethical oversight is not about research ethics committee or boards. It's about having a mechanism, whatever the mechanism is something we have to negotiate with these communities about to make sure that the principle that these communities accept as the ethical principles of their priorities are respected and implemented. And by the way, one of the good things about the model that they have developed is that the continuous monitoring, they have the kind of data safety monitoring board kind of thing, because they are watching the data collector while they are moving in their communities. I believe that more guidelines and committees is not the answer. We need empirical work. I'm not saying that my work is perfect. It's just a start, and I believe that much work is needed to kind of explore the realities and complexities of humanitarian situations. I believe that moving from research on people to research with the people, this is the kind of the trend. Is we're not kind of like forcing people, but working with the people to make their life better. I believe ethics should follow. So we need to move ethics from on the people, group of people sitting somewhere in a closed office in an European city telling the world what they should do, to ethics from the people. We need to talk to the people, especially those in these dire situations, and for the people to make sure that whatever we do, whether it's research or humanitarian activity, is done for the people and for their own benefit. And who tells the benefit, who sets the priorities, is the people themselves and not anyone else. When the people talk and we listen, I believe that the ethical concepts and practices can be revisited, reimagined, and redesigned. So don't stick to a certain concept of consent, for example, or certain concept or understanding of autonomy, and stick to it and try to kind of like twist all the practices to fit within this. We need to kind of have the moral courage and the moral imagination to think research ethics in these different settings in a different way, using a systematic approach to that. Thank you.
Ghaiath, thank you very much for a very interesting talk, presentation, and you must have had quite an interesting experience in many ways. What I'm going to do is I'm not going to raise any questions because I've already had the chance to do that when you presented at the prep, but I'm going to give the floor to my colleagues in case they have anything to inquire about. Please do go ahead. Any questions, Dr. Ghaiath? well, your presentation is very, very delicate and very detailed.
Hello?
So I don't think there's anything that's
There's
unclear.
someone is trying to ask.
Excuse me?
Yes.
Sharbel, you want to say
Yes.
something?
Yes,
Tfaddal.
hi. Hi, Dr. Hussein. That was a very nice presentation. May you please give an example of how you transform an ethics from the people to the people, with the people, instead of on the people to the people?
Okay, thank
Like
you.
a brief example.
It's a very good question. Thank you. So, for example, let's take the example of consent. Okay, so now we can move quite comfortably, at least in the context that I have studied. We have studied this community, and this community now they are agreeing on having verbal consent with selective disclosure and a kind of iterative consent rather than one-time communication process. So we can shift or move the guidelines or readapt the guidelines for this particular context to that, okay, for the researcher, they can apply for us without being afraid of being accused of being crazy, that I'm going to have verbal consent, I'm not going to tell them everything, and it's for the community to decide whether they want to be part of my research or not. So this is just an example, and I believe we can take it to different perspectives as well. For example, to have a role for the community structures in the review process, and instead of having the whole thing done by the IRB or the Research Ethics Committee in a university or a MSF or other or WHO or any other organization, why not give a part of the review process and ask the researcher to have uh, to some proof that the community is okay with the study. I'm not talking about the formal approval, that the approval from the Minister of Health or the department or this department or that department, but from the community. How to do this? Perhaps it needs some again some structuring, but I believe the main challenge is not to find the way to do it, but rather to have the imagination that how can we reimagine research ethics beyond what we have been learning, teaching, and writing for the normal peacetime? So this is just a couple of examples I can think of.
Yeah, thank you so much.
So Ghaiath, if I may play the devil's advocate here. So we all know that in general, even at the risk of oversimplifying things, the aim of research is to generate objective generalizable knowledge. Now, if you look around us, particularly the last few years with the pandemic and the so-called vaccines or medications and what have you, and the number of studies that have been rejected or proven to be fraudulent or not satisfactory, in addition to infodemics and what have you, even contradictory studies being released almost concomitantly. The first question is, to what extent can you say that you really have faith in science? In other words, we used to say, whenever we read something in a study, we would say, "Khalas, there are studies that show that X are Y, so X are Y." But now we're not there anymore. Something has shifted and trust has been eroded. So that's one. The second thing, if I may, and that's rather a simple one in the sense that we are all facing it, when research protocols are reviewed by RECs, but in a plethora of areas, particularly in the MENA region and in areas plagued by wars, RECs are not equipped actually to really revise or to really revise the protocol the way they ought to be. They're not trained, and you get this rubber stamp of approval. Sometimes the informed consent form is requested to be edited. They edit it, but they use the old one and what have you. So, what's your take at that? And thank you in advance.
Okay, thank you, Tanya, for the question. For the first part, I believe that it's what the point you're raising. I believe it's kind of supporting what I'm saying, because we have an issue of trust, right? So there's a huge in an armed conflict setting. There is even more hesitation to accept any strangers or outcomers or newcomers to the setting, so that's why they're very hesitant to accept or to take things easily. Let's say, and that's why you have to pass the trustworthiness test, if you wish. So I believe that the involvement of the communities in the different phases, by the way, and this is a trend now, that the public should be involved in the not only in the implementation of the study, and not only in the review of the study, but even in the development of the proposal itself. I mean, from the very beginning, if the humanitarian agency is working in that area, especially if they have been there, for example, as I told you, the international organization have been in Darfur since 2003. They have been in Syria since 2011. They have been in Yemen since 2016. So they had time. They have been there with these communities. They had the time to speak to the communities, to see their needs and to involve them. And I believe that if someone is involved in the study from the very beginning, it's less likely for him or her to reject the outcome of this study. So in that sense, but if for example, what the example that you have given about the vaccines and the medications and so on, then we are talking about because they, in a way they were done in a rush and in the blind. We're not part of the process of, we were not quite sure how were they developed. I'm talking even about the professional level. I'm not talking about even the general community. So I believe that the active involvement of your target group in the process of developing the proposal itself, it's important, and because it helps in building the trustworthiness in the findings when it comes. As for your second question, yes, I do agree that the ethics capacity, I mean, publication after publication, study after study is telling the same thing for more than a decade. You've been doing a great job, and I believe that many other colleagues in the MENA region, they have been trying so hard to raise the capacity, but given the lack of perhaps the political power or the political willingness to make a change to that. So, and I believe part of it, I don't want to put overburden on the international organizations, but I believe that they have the ability to build the capacity of the research ethics committees in these countries. Big organizations like UNICEF, like WHO, like many other organizations, they have the capacity to train the people on research ethics, to help them to establish, to maintain the research ethics committees, at least to have a nucleus that can later on, that we can build on. We can train the trainers and many other initiatives that can be done uh, by the international community, by the humanitarian agencies, by the funding agencies. So, for example, let's assume that what if I am an international organization, I'm raising the fund to help this community affected, say, in Yemen or in Syria or in Sudan now. So part of this fund should be dedicated to the development, the capacity, to build the capacity of people there. By the people, I mean the researchers, to have to be better researchers, to the community by health education, by establishing something that remains after they leave, because sooner or later they can't stay there forever. Inshallah, yani, we do hope that things will come to an end. The conflicts in the region will come to an end. Maybe they would appear in somewhere else, but at least they will end. What will happen to these communities if they keep on this heavy reliance on the humanitarian aid, to the point that when the governments take over, they refuse to take the service of the government because it's less the standard that they are used to for many years. So to a short um, answer to your question, I believe that we can all work on that together. Whether the academia, the humanitarian agencies, and I repeat that because I believe that humanitarian agencies have an important role, not only to feeding the people and provide them with tents and shelter, but also to improve their life when it comes to resilience and to take into the consideration what will happen after the armed conflict is over, because they are not going to live the rest of their lives in camps often.
Thank you very much, Ghaiath. Anyone else has any question?
There's Hala Al-Azawi has her hand raised.
Yes, hello. Thank you, Doctor, for your presentation. It was very insightful. My question is kind of more on the field. I was wondering, due to our Middle Eastern culture and norms, women are, the community is quite conservative when it comes to women and sharing their opinions. And I was wondering, how was your data affected when you're trying to collect that from a community? especially during armed conflict where, it's even more tense and I'd say secluded?
Thank you for this. Well, given that this is being recorded, I can't give you all the details. But anyway, but let me tell you this. What happened is, when I had the ethical approval, obviously that I am the one who is doing the focus groups. I'm the one who's doing the interviews. But when I well, for some reason I did, for obvious reason, actually not for some reason, but for obvious reasons, they said no, our women should be. We don't mind. It's okay. You're a good guy, but we cannot let you to our women to sit with them alone. Given that I have emphasized that women should have their own focus group, so they said no way. Send us a woman. Okay, so it was kind of a trouble because I talked to my supervisors and they said no, we have to reapply for the ethics committee, and this is a kind of a major change, and we have to consider that. So after some negotiation, I managed to convince them that I'm going to train a couple of colleagues, female colleagues in the Ministry of Health, with some experience in qualitative research, and I have trained them on the specific questions of that study, and then I sent kind of like, and then introduce them to the committee leaders. Okay, these are my colleagues. Are going to ask, and then yes, and give them the questions, and let me tell you what I did, and perhaps we can chop it later from the recording. So what happened is that I was listening, basically. Given that in the original ethical approval that I had, I didn't do anything unethical. So what happened is that I wanted to make sure that I have been following what's being said. So I was kind of listening to them over the phone, just to make sure that everything was okay. And to be honest, it went fairly okay. A few hints, just perhaps that I needed to just to remind the research assistant to ask about this and to emphasize about that. But otherwise, they've done already great. So this is one way to go through it. But instead of wasting this, I believe that we need to be honest, the issue was a little even bigger than that, because I believe that an ethics committee in a European university would find it difficult to understand the cultural sensitivities and the importance of involving someone else in your project. But eventually, this is the way it should be done, and they should be aware of that and should kind of like be flexible a
Yeah.
little bit when it comes to that. Yeah.
Yeah, exactly. I also personally think that your solution was great. It was both respectful to the community and also you're abiding by the ethic rules and making sure that your, mediator was following the rules. Thank you.
Thank you.
I've also have George Chingaran who has his hand raised. George, go ahead.
Thank you for a very exquisite presentation. I've got a couple of related questions. So in your model, there is the gatekeepers that kind of vet the trustworthiness of the researchers that are coming in. So if the gatekeepers deem that the researchers are not trustworthy, what happens? And doesn't that take away the sovereignty of the individual participant from deciding for herself whether or not she should participate? Because the gatekeepers have already, I presume, denied access to the community, to the researchers. And that is part of my question. And then the second part would be the composition of the gatekeepers, and how powerful are they? In certain communities, different cultures, some of them may be all male, and yet they may arrogate to themselves the responsibility to decide whether this research is proper or not, with ladies or other vulnerable populations?
Yeah, yeah. Thanks for your question. It's a great question, and to be honest, what I'm presenting is not kind of like I'm not assuming this is a perfect situation, given that there are many possibilities. As you just correctly mentioned, that could be an old male, like so arrogant, he wants to can control. Sometimes they even straight straight away corrupt. They might ask you for money, for example, for something special for them. Uh, or many other scenarios. Sometimes they have even their political affiliation as well. For example, if the community leader, but usually more or less they reflect the community affiliation, the political affiliation of their communities. Uh, s- but one thing that we need to take into consideration, and I understand this could be difficult for us to digest, which is sometimes in these settings, due to the vulnerability, the fear, the social restructuring, as I call it, it's basic. What happens is they kind of delegated their freedom of choice to the community leaders. Why? Not because the community leaders are great, are absolutely like angels, or they're like their parents or something, no, but because they are the ones who are the gatekeepers for everything. They are the ones who are defending them, negotiating their rights. So sometimes we have, well, uh, political affiliation towards a certain party, okay, a political party. This does not mean that, in general, we are kind of in accordance with this, with the general agenda and the manifesto of that party. But this does not mean that I'm happy with each and every member of parliament or senator representing this party. So what I'm saying is, sometimes we do delegate part of our freedom to the policymakers, to the politicians, to the gatekeepers in this case, and they make wrong decisions. Sometimes they make corrupt decisions, but this does not mean that the process is necessarily wrong. For example, uh, don't want to offend my colleagues in Lebanon, but you've just had your election, right? So some of the, well, those who went to the parliament perhaps were not the best representation of their communities, and they were elected for very wrong reasons sometimes. But this does not mean that democracy is wrong or election is wrong, because some of the produce of this process is wrong. Uh, how to make sure in a way that the community leaders are not abusing their power as gatekeepers. I believe that most of them have to deal with the humanitarian agencies, especially the international organizations. And I believe the international organizations have a say on the extent to which these leaders can go. Some of them go really extreme. One example was that when the government of Sudan repelled 13 organizations and asked the rest of the organizations, international organizations, asked them to kind of compensate and cover for the repelled organizations. One of the camps, I don't want to mention the name or the leader of that camp, stopped any humanitarian aid from coming to the camp. No vaccines, no clinics, nothing, until the repelled organizations come back. And this led to, for example, there was a meningitis outbreak in the camp. There were deaths. There were malnutrition, went through the roof. But if you go to the people and you are not coming through the gatekeeper, you will, yeah, literally, you will be followed by sticks and stones. And this happened to us when we went without, uh, by ourselves, just as a household. And then the community leader was not happy in one of the camps in Darfur. He just sent a sign, and we were rushed to the UN vehicles to leave the place because they were following us with stones and sticks, because we did not have the permission of the gatekeepers. This is not perfect, but this is what it is. How to deal with it, this is something that we need to think about and negotiate with those in the ground.
Thank you. And the other bit is to do with what I would call an empty choice. Given a scenario where, number one, during a conflict situation, the gatekeepers tend to become more and more powerful, whereas the vulnerable populations become even more and more vulnerable. And the NGOs also begin to assume even more power because they are supplying most of the things that the vulnerable people need. How effective is individual consent in those situations where, for example, the only help to treat meningitis is coming from an NGO, and the NGO is bringing this treatment as an experimental drug, and really you either enroll on the study or you die of meningitis, which becomes an empty choice. Although we say yes, this is informed consent. Is it really informed, or was the participant coerced by the existence of a choice that was not a choice at all?
Yeah, I think it's this is just one example. There are many examples, unfortunately, of agencies and organizations. Just I was scratching the surface about the semantic review. By the way, I found studies that have collected blood. They sent the blood outside the country, and in addition to other biological samples, they didn't mention anything about having ethical approval or informed consent. And it's out there in the publicly available. They're not hiding this. So I believe that this brings me back perhaps to the point that Talia raised at the very beginning about raising the capacity of the local research ethics committees, the local researchers on being to be the eye of the people and perhaps to be involved more actively in the process. Well, fortunately enough, I would say that most of the funding agencies, and including those who fund the humanitarian agencies, they try to make sure that it is ethically approved. And if it's obviously this kind of scenario that you have mentioned, if they go to any ethics committee, they would say no. You have to provide them with the standard of care. If there are vaccines, give them the vaccines. If it's a trial, you should, and this is one of the main problems that I encounter when I review the proposals from an NGO, international organization. It's about this vague. There's lack of clarity in terms of the dual role as researchers and providers at the same time. So they test on people things. It's not something serious like a new medicine, but for example, a formula for feeding children, or perhaps a new combination of medication, and sometimes even new medications. They do this and they don't call their proposal a clinical trial or a controlled trial in any way, although it fulfills all the criteria that I am aware of a controlled trial, of an RCT, but they don't call it so, and they go and do it. And this is, well, I'm fortunate that this organization is sending the proposals to an ethics committee somewhere, but many other organizations, they do not have any ethics committee for them, and there are no ethics committee in the affected areas. So what happens is, I assume that, I'm not accusing anyone, but I assume that many of these studies, let's assume that they are done in good faith, but eventually there are clinical trials that should not have been let go in the first place without proper ethical approval and follow-up. So this again, it's kind of a complicated situation, but I believe that if we work together on kind of having a clear mapping of what are the issues are and who are the stakeholders, then I'm quite sure that we can find a way to overcome all of these difficulties and challenges.
I guess there's one more question, I think, on the chat. Is that okay with you, Dr. Ghaiath?
Yeah,
We're
sure,
taking
sure,
more
sure.
than your time.
Yeah.
Okay, so this is a question from Diana. Talia, can you kindly read it?
Yes, sure. Sorry. Yeah, we have one more question. You mentioned that it is made clear to research participants, for example, that they will not receive any direct benefits for their participation, but it is possible that in some way they hope for it. Is there any study that has looked into research participant feedback on the long term after a study, if they were disappointed that they did not get to see any tangible output or regretted?
I'm not aware. I can't remember and recall any studies now, but I can tell you, and perhaps we can close with this. It's a personal experience. When I found that these communities, the community that I have targeted, they were again and again expecting something like we and they didn't tell me give us, or they did put it, if you don't give us, then we're not going to participate in the study. But they keep on repeating their needs, that they need help, etc., etc. So, and obviously, what I said, and I had to say, because as a part of the ethical approval, and this is the ethical thing to do, is I'm not in a position to give you any tangible, direct help. However, what I did, without promising them anything, and after I have started, or actually I have almost at this stage, I had almost finished the data collection. No, actually, after I have finished the data collection, what I had done is I have raised their needs and sent it to the news community in Birmingham, where I used to live, and told them that this is the group of IDPs. These are their needs. If you can help them, this is the name, not through me. This is the name of their community leader, and you can contact him and negotiate with him. And guess what? In less than a week, almost double what they needed was there. So again, uh, it's not always as easy and as beautiful as I describe it. I was quite lucky, I'd say. But the you cannot stop people from hoping, right? Because they are desperate, they need. And as I said, whoever knocks the door on someone like in a terrible camp, with a terrible tent that don't protect them from cold and rain, then they will accept someone with a blanket, right? So we cannot stop people from hoping, but at the same time, we cannot uh, make it tit for tat, or something. Okay, this is the aid that you need. Okay, give me your data or give me your blood. Because this will be a slippery slope if we open this door. So the best way is to separate between the aid track, the help, and the research track. And this is again the importance of be aware of your role as a humanitarian agency, as a provider and as a researcher. It's not always easy. It's most of the time it's difficult, but this is why we need an external eye, the ethical oversight, to make sure that you are not overlapping and not coercing or abusing people in any way. I hope this answers your question.
Yes, thank you very much. We've taken a lot of your time.
No, really, I enjoyed it. I enjoyed the questions, and I hope I was.
I can already see a lot of likes.
Thank you.
Maybe another question from George,
Yeah, sure, please.
or you just saying goodbye?
Saying
Okay.
thank you.
Oh, it's a thank you. Thank you.
Okay,
Thank
great.
you.
You're welcome. You're welcome.
Okay, we'll keep in touch. You have, again, likes going up.
Thank you.
And to be continued. We'll talk later. Thank you,
Yeah,
Ghaiath. Thanks
sure.
a lot,
It's
and
always
thank you,
my pleasure,
everyone.
Sai. It's always my pleasure. And I really I do commend you for the effort that you're doing. The series is a great series, and I think it's really helpful. It's really helpful,
Bless you.
and I believe that keep the good job. You're doing great as usual.
Thank you. Bless you.
Bless you.
Thank you,
Thank you,
Dr. Ghaiath.
everyone.
Okay, thanks Tara for organizing all the things, and thanks everybody for your time and for your questions and discussion. I really enjoyed it, and hope to meet you soon. Thank you.
God bless.
God bless.